This PowerPoint lecture is on Chapter 4, Prenatal Development and Birth. Once an ovum is fertilized, it becomes a zygote. And the period of conception through implantation is called the germinal period, and it lasts about 2 weeks. Initially, it's nourished by the yolk of the original egg, and once it's implanted, it's nourished by the mother. The embryonic stage begins with implantation, which is around 3 weeks to around 8 weeks. All development, whether you're going to turn into a chicken or an elephant or a person, all goes in the same direction. And this is cephalocaudal, proximodistal. So cephalocaudal is from head to tail, and proximodistal is inside out. Initially, the neural tube begins to form, and this is going to be the brain and the spinal cord. By the end of the first month, the neural tube is producing 400 million neurons a day. The heart begins to beat around the 3rd week, and the cardiovascular system is the first system to show signs of activity. Arms and buds and legs appear around the 4th week. Eyes, ears, nose, and mouth begin around the 6th, and limbs elongate and facial features become more distinct around the 8th. How the embryo begins to get nourishment from the mother? Well, the amniotic sac protects the embryo or the fetus within the uterus, and the sac is surrounded by amniotic fluid. The placenta is a massive tissue that exchanges nutrients and waste between the embryo, fetus, and the mother, and the umbilical cord connects the fetus to the placenta. A typical pregnancy runs 9 months and is divided into 3 trimesters. The fetal stage is the stage that starts around the 9th week. The first trimester, the first 3 months of a pregnancy, we see all major organs and systems are formed. Fingers and toes begin to form, and external sexual organs can be seen. By the end of the 2nd trimester, around 6 months, a fetus opens and shuts its eyes, may suck its thumb, alternates between sleep and wakefulness, responds to light and sound. At about 22 to 25 weeks of gestation, about 50% of babies that are born will survive, and at the end of 7 months, 90% survive. Nutrition during a pregnancy is really important, and everything that the mother ingests potentially affects the developing fetus. So malnutrition with the mother can produce low birth weight, premature babies, cognitive deficits, behavior problems, and cardiovascular disease. Some other effects of fetal malnutrition can be overcome by supportive caregiving environments, but if a baby is really exposed to long and severe malnutrition in utero, that can have an impact on the child. Pterogens are any environmental agents that can harm the embryo or the fetus. They can be drugs that the mother takes, substances, heavy metals such as lead or mercury, pathogens, bacteria, viruses, and chronic stress. Keep in mind we all experience stress, but if you're growing up or living in an environment where life and death is a day-to-day stressor, that would be definitely considered chronic and severe stress. An example of this would be growing up in a country that is experiencing war. Diseases. It used to be that German measles was really extremely dangerous to contract if you were pregnant. A baby could be born blind, have health problems, heart difficulties, could be born stillborn. AIDS, if a mother contracted AIDS, that there was a 25% probability of passing that on to her baby. Currently, there are drugs and other medical interventions that can help a pregnant woman. It's unusual to not pick up a bottle of even aspirin and see some form of a medical alert on that to warn that if you are pregnant, you should really talk to your doctor about taking that medication. Accutane is an acne medication that, if taken while pregnant, can cause very severe birth abnormalities. In the 1960s, there were drugs that were given to pregnant women for morning sickness. Primarily, a lot of the drugs were distributed in France and in England, and babies were born missing limbs or stunted growth. Antibiotics in general can cause yellow teeth and bone abnormalities. Most pregnant women take vitamins under the direction of their doctors, but high levels of certain vitamins can be very toxic for a developing fetus. High levels of A and D can cause central nervous system damage. Other drugs, heroin, methadone, can cause low birth weight, premature toxemia, can be born addicted also. Marijuana, risk of low birth weight, immature development of the nervous system, and there's some difficulty with studying the effects of marijuana on central nervous system, but anything, again, that has an impact on the mother can potentially have an impact on the fetus. Cocaine can produce the risk of stillborn, low birth weight, and other birth defects. Alcohol, fetal alcohol syndrome, and then there's fetal alcohol effects. Fetal alcohol syndrome is a full-blown syndrome where we see stunted growth, bone abnormalities, major cognitive impairments. Fetal alcohol effects, you might not see some of the physical distinctions that we see with fetal alcohol syndrome, but you might have behavior and learning problems. The bottom line is, if you think you're pregnant, the safest level of drinking alcohol is no drinking of alcohol at all. Again, you want to be talking to your physician, but the safest level of alcohol intake during pregnancy is none. The effects of drugs taken by the mother continue with even caffeine or energy drinks. There's concerns about high blood pressure and other side effects. Cigarettes is low birth weight. If you're only going to weigh about 7 pounds when you're born, we want a baby coming into the world with as much development and birth weight on them as possible within a healthy range to help support their development and their survival rate. And remember, too, that men contribute to the health of the gene pool. So how healthy the father is may potentially also impact the baby. There are a lot of environmental hazards that we're exposed to these days. Heavy metals, lead, zinc, mercury can threaten cognitive impairment. Exposure to heavy metals, radiation, toxic materials also can create abnormalities, not only in ovums, but also in sperm. It's really important that if a woman thinks she's pregnant, that she gets good prenatal care. In addition, if a couple are sexually active, to keep in mind that even if birth control is used, that a pregnancy may occur. In your textbook on page 115 is a very good chart about critical times of development, and that's very much worth looking at. In addition, in your textbook, there is information about the formation and the important emotional components of becoming a new family. So there's information about becoming a new mother or becoming a new father, and so that's worth also reading and important to review. And lastly, your chapter has some nice information and some links about cross-cultural variations, not only with childbirth, but also with family roles. And that's worth looking at.